My name is Jeremy. I was diagnosed with cystic fibrosis when I was 6 months old. I had a lung transplant in September of 2012.
My name is Joy and I'm Jeremy's wife, and we've been married for 13 years.
I live in Altoona, Pennsylvania. We have 2 children. Their names are Gavin and Joelle. Before I had my transplant, I was working full-time. I have ever since I was 18. I was always doing so well that transplant just never came up in a conversation with the doctors. It was only a month, 2 months before my transplant that I was actually placed on oxygen. September 1st of 2012, I was life flighted to Pittsburgh. About 2 weeks after I was in the hospital, a nurse approached me about transplant. From that point on, I don't really remember what happened.
He was placed on a ventilator and transferred to Presbyterian, worked up for a transplant and placed on the list. I was definitely going on adrenaline. I didn't eat, I didn't sleep. Many phone calls, meetings. I talked to the social workers, many doctors. He went into full respiratory failure, so they had to place him on ECMO, and that kept him alive for a few days until a transplant came in. After he was listed, 29 hours later, he got a transplant.
I think that in CF clinic, they should start at a young age to start to educate patients about transplant, so it's not a scare whenever it is time for one. With CF, you're so concerned about how you're doing at the present time because you never really looked into the future, so it never really crossed my mind to think about transplant.
Now seeing how many transplants are done on a daily basis.
And the success rate.
And the success rates. Being educated on that, it's not so scary.
And people can look as a transplant as the second lease on life because there is so much more after transplant, that it's not the end.